Now we get to medicinal chemistry. I'm sure this is the part of the course you've been waiting for all year long. And essentially, why this is so important is because medical practice in the United States and much of the world rely upon chemicals. They're diagnostics based upon chemical analysis or reactions with the patient's blood samples. They have pharmaceutical intervention with prescription or over-the-counter medicines. Yes, there are surgical interventions, and sometimes they have to do replacement parts, and radiological interventions. So 3 of these right here involve chemicals of the type that we're talking about. We just talked about the radiological interventions in the last chapter. But we're going to talk about these right here now. So pharmaceuticals are a very large market in the United States. Back in 1968, sales were only $3.7 billion. By 2016, this had grown to $446 billion. And this past, a couple years ago, last one they have data for, it was $482 billion. So that's a lot of, essentially, when you are visiting a doctor or in a medical practice, most of the time, it will be a prescription or some medical therapy or at least a diagnostic that the doctor will be using that will be based upon chemistry. Some of them now are biologicals. As a matter of fact, a lot of them are the bulk of this money actually is because of the high cost of biologicals right now that are given mostly in a hospital setting. And we'll distinguish those from the small molecule chemicals as we go through. I'm not going to cover the molecular biology for the biological materials that are part of the medical practice today. Now, early pharmaceuticals were oftentimes based on herbal products. So, for example, salicylic acid, which we had in our laboratories as an analgesic, in other words, taking care of pain, has been around since the Sumerians, right? The Egyptians, the Romans, the Greeks, everybody from the Sumerians on have utilized salicylic acid. Quinine was first established as a specific material that could be used as an antimalarial in the year 1639. Morphine came along as an analgesic in about 1820. Ether, and this is actually ethyl ether, started as an anesthetic used during surgeries during the Civil War. Cocaine as a local anesthetic, and that was we're talking about medical uses here, because I'm sure that the Incas and other people were using it as a way to take care of their breathing issues at higher elevations long before 1879. But as a local anesthetic, 1879 is when that started. Okay, nitroglycerin as a vasodilator also started in 1879. Digitalis as a cardiac stimulant was 1890. Aspirin, essentially the acetyl salicylic acid version of the earlier drug, is an analgesic. That started in 1894 by Bayer over in Germany. Phenobarbital as a hypnotic. Okay, in other words, this was something that they used as an alternate anesthetic to ether. Was started in 1912. Arsphenamine was an antisyphilitic in 1925, and sulfanilamide was an antibacterial, was in 1932. Most of us think of the penicillin as the first antibiotic, but that actually didn't happen until 1940. Sorry, this thing just jumps around from time to time. These are ones that were introduced between 1940 and 1970. And you can see that we went from antibiotic to analgesic, meperidine, in 1944, something to stimulate the CNS system, amphetamine. Okay, that started in 1944. Actually, it started even before that. It was introduced a few years before that non-medically approved, of course, but our pilots used that extensively for their long bombing raids and everything throughout. So the Air Force essentially was creating a bunch of amphetamine addicts, but it was the only way that they could do the job that they had to do at that time. Antihistamine, that was our friend Benadryl. That was came along in 1946. Banthine, antispasmodic. This was something to help control epilepsy. That occurred in 1950. Phenylbutazone. This is oftentimes just called bute, and was been abused extensively in some of the horses and other things. You damage a horse's muscle, and it's not a good thing to be injecting into anyone. But as an anti-inflammatory, it started in 1952. It needs to be in very, very close, low dosages if you're going to use that. The first antihypertensive was hydralazine, and that started in 1952. Chlorpromazine as a tranquilizer in 1954, and meprobamate in 1955, and something to start controlling type 2 diabetes for an oral hypoglycemic was tolbutamide, and that was in 1957. So all of these were introduced, and this was really the start of having a lot of chemicals as pharmaceuticals. And the only difference between a chemical and a pharmaceutical is the amount of information associated with it. Because if you build up your information in terms of the safety profile and the way in which it interacts with the body, you can then, that's what it takes to take a chemical to become a pharmaceutical. These are additional ones introduced between 1940 and 1970. There was a diuretic, chlorothiazide, in 1958, hydrochlorothiazide in 1959, and these are used to some extent still in the patients that are having cardiac problems as effective diuretics. An antidepressant came along in 1959, imipramine, right? Tranquilizer, chlorodase epoxide in 1960. Now we had our first anti-cholesterol drug, clofibrate, in 1962, and the first non-steroidal anti-inflammatory, that's an NSAID, non-steroidal anti-inflammatory drug, is indomethacin, and that came along in 1965. Now, this list did not include the vaccines. The first vaccine was actually for the smallpox, and that took place in general practice in 1800. They had tried it a little bit before that, even during our Revolutionary War. There were some places that were trying it at that time, but it was not in general practice. It didn't go into general practice until about 1800. Also, insulin as an to take care of a deficiency in the body, that didn't occur until 1921. But I did not include vaccines or these biological replacements since they're not small molecules. Now, the pharmaceutical development since 1950 shows treatment moving from pain, inflammation, infectious disease, and muscle control, the GI tract, and those sorts of things. Those were what all the drugs prior to that were. Now they started to design those treat problems associated with old age, such as coronary disease. That's your ones were your diuretics and things like that, and cancers. Okay, unhealthy lifestyle, your type 2 diabetes, and affluence without moral direction. Okay, in other words, if you don't have a relationship with God, depression, anxiety, and substance abuse occurs, and essentially they look to the medical profession to try to solve those. It was always been the case here in America, where you just want to take a pill and have your problems go away. And unfortunately, that rarely works that well. Now, the Food and Drug Administration now divides pharmaceuticals into 33 major categories, with many having several subcategories. The categories are now based upon disease area treated, with subcategories into the mechanism of action. For example, if you had a major category of cardiovascular agents, something for the heart, one of its subcategories would be beta adrenergic blocking agents, or beta blockers. And there's over just in this small subcategory, there's over 20 individual compounds in this category. So here are the 33 analgesics, okay, and these are oral analgesics, okay, and there's further subdivided into those that are opioid and the non-opioid. You've got your analgesics that are local, and then you have your anticonvulsants, okay, yeah, what is not, there's one other I'm missing here. You should have been antibacterials, should have been located right in here as well. So it would have been 34. But antibacterials are all of the different penicillin and the quinolines, the sulfonamides, the tetracyclines, all of those would have been right in that group. Anticonvulsants. These are calcium channel modifying agents, the glutamate reducing agents, the sodium channel inhibitors, things to essentially control epilepsy, right? Antidementia is the next one, and there's a couple of cholinesterase inhibitors and glutamate pathway modifiers. This is a fairly new group. It takes a lot of effort to develop something in this particular area. Antidepressants. This is your monoamine oxidase inhibitors, your serotonin or norepinephrine reuptake inhibitors, tricyclics. So antidepressants is has since 1958 first introduced that one, have been a very, very strong area that people have been working in. Just a lot of people don't like to face reality. Okay, and now we have two that don't belong in this list. The next one should have been antidotes and detergents. These two belong to a different table. Antidotes and detergents. Antidotes and deterrents, not detergents, deterrents. In other words, these are opioid antagonists, smoking cessation agents, and alcohol deterrents, so that if a person is on this medication, if they try to take alcohol, they will find that that their stomach rebels against it. Antifungals. This is the allylamine antifungals, the azoles, the polyenes, a lot of different ones for treating all sorts of different fungal diseases. Anti-gout agents. Rarely hear about gout these days, but these are xanthine oxidase inhibitors and renal tube blocking agents in this category. Anti-inflammatory. You have two categories here, your glucocorticoids, and the non-steroidal anti-inflammatory drugs that we talked about before. Anti-migraine. There's two different ones. There's ones where you try to stop the ongoing migraine, and then you have those that you take prophylactically. Prophylactically, it's beta adrenergic blocking agents, and for the other ones, it's triptans and ergoalkaloids for the ones that try to just stop the activity. Anti-neoplastic agents, these are your anti-cancer drugs, and there's a whole list of different ones. Alkylating agents, anti-angiogenesis ones, anti-metabolites, aromatase inhibitors, and then there's molecular targeting ones that are all biologics, the Herceptins and the factor receptors and multi-targeted kinases and those. So we'll stop there and continue on beyond